Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. This is Medicine of the Prophet, your guide to healthy living. I'm your host Farooq Hussain, and in today's program we'll be looking at the concept and practice of cupping. To discuss this issue with us, we have Professor Bhika, the prime mover of this program, and also our guest, Dr. Mujib Hussain, who will be delving more deeply into the concepts around cupping. In this segment of the program, we'll be looking at the rationale of cupping. But the questions that will be raised in this episode as a whole include the following. What is the history of cupping with reference to hadiths in prophetic medicine? What are the different types of cupping? What is its relevance to health promotion and illness management? And how might viewers benefit through the sunnah of cupping? And lastly, does cupping fall in the category of preventative medicine? I should like to draw in Professor Rashid Bhika now and ask Prof. Prof, I've heard that cupping is a well-established practice in prophetic medicine. For our benefit, could you shed some light on the history of this therapy?
Yes. Jazakallah khair, Farooq. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillahirrahmanirrahim. The practice of cupping goes back million years, thousands of years. Practiced by many different cultures, many different peoples. Okay, so this is nothing really new. And this is evidence, if you look, for example, at the tombs, in China, the ancient tomb of the Han dynasty. And if you look at also many of the inscriptions in the Greek times, the Roman times, and like this, I'm sure even in African traditional, you'll find some other inscriptions. So cupping has been a well-established therapeutic practice for thousands of years by many different people. Of course, cupping then, based again on the Quran and Sunnah, it was really re-emphasized, reinforced, and a lot of the wisdom behind the practice of cupping was enunciated by all the Muslim contribution to healthcare. There's Razis and Ibn Sina, etc., etc. So during that period of Muslim contribution in medicine, the rationale, the wisdom, and taking into account from the context from Quran and Sunnah, that was actually developed so much more. So yes, in a nutshell, cupping goes back for thousands of years, and with Muslim contribution, the practice or the rationale behind the practice was studied, understood, evaluated, and fully sort of explained. All right. Cupping also then after the Muslim contribution, even in Europe, it was a practice, an established practice until about 100 years ago. So without a doubt, cupping is not new. It was there, and its value in therapeutics is absolutely essential.
And also in science, of course, it has been verified to prove quite useful in dealing with certain types of illnesses.
Yes. In fact, my colleague Mujib here, who's been doing a lot of research on it, will highlight some of the facts.
Wonderful. Dr. Mujib Hussain, let me draw you in here and ask, that mindful of what Prof has said, that cupping has become a renowned therapy in terms of prophetic medicine. Can you share with us some of these prophetic traditions?
Of course. Assalamu alaikum wa rahmatullahi ta'ala barakatuh to all the viewers. Bismillahir Rahmanir Rahim. When we refer to cupping and we look at the Sunnah, there's numerous ahadith or traditions on cupping. Actual number plus minus 28 ahadith mentioning to the recommendations given by the Prophet ﷺ, giving us a comprehensive understanding of cupping, how it was performed, on which parts of his blessed body was it performed, for which type of illnesses was it performed, even the dates of the month when cupping was performed. And there's even details on the fee that was given to the cupper, meaning that cupping was recognized as a profession, as a medical profession of the time. And if we look at the hadith and we look at the comprehensive nature of it, undoubtedly cupping remains the single most well celebrated medical recommendation by the Prophet ﷺ on our health. And there's so much ahadith to mention from, but I just wish to take two due to time constraints. On the authority of Anas ibn Malik, He narrated that the Prophet ﷺ said that on the night of Al-Isra wal-Mi'raj, the night journey, the Prophet ﷺ said that I did not pass any group on that night, referring to the group of angels, except that they said to me, O Muhammad ﷺ, tell your people, tell your ummah to do cupping. This hadith is found in Ibn Majah. This hadith is very essential to the understanding of how cupping fits into prophetic medicine, because we know that the Al-Isra wal-Mi'raj was a significant event. It was the heavenly journey, the heavenly ascension, where the Prophet ﷺ was given advices for the year after. However, and the biggest advice or recommendation for this ummah, the instruction, the divine instruction, was the salah. So everything that the Prophet ﷺ received in that night had major implications to this life and the year after. So we find that every group of angels mentioned to the Prophet ﷺ do cupping. Another famous hadith mentioned that is found in Bukhari and Muslim, and we know that Bukhari and Muslim are the two most authentic hadith compilations. The Prophet ﷺ said that the best medicine with which to treat yourselves with is cupping. That's the exact wording. And these are just but two hadith from the many. So here we see that cupping was definitely entrenched and enforced in the Sunnah, in that it became a big part of the treatment for natural medicine, and from there cupping developed into the science as we know it today.
Well, that's fascinating, and in particular in lieu of the spiritual implications that you've raised now. We'll be taking a short break now in our program, and when we return, we'll be looking at the cupping procedure, its rationale and medical benefits. That's still to come, so please do stay with us. Welcome back, and thank you for staying with us. If you've just joined us, you're watching ITV's program on Medicine of the Prophet, your guide to healthy living. And with me in the studio is Professor Rashid Bhika and our guest, Dr. Mujib Hussain. In this segment, we'll be looking at the cupping procedure and its rationale and medical benefits. Also, my guest, Dr. Mujib Hussain, will explain to us the success in the treatment and also the prophetic wisdom related to even the cupping on certain days of the month, including the 17th, 19th, and 20th day of the lunar month. Professor Bhika and Dr. Mujib Hussain, thank you for sharing your wisdom. Dr. Mujib Hussain, more specifically, you're a cupping practitioner as well. Can you explain to us what cupping is and how it works, and what are its clinical benefits?
Okay. Basically, cupping is a medical procedure, a treatment that aims to target specific points on the body via stimulation of the skin with the use of cups similar to this. So a cup is placed on the skin, a vacuum is created within the cup, so air is withdrawn out of the cup. So
through the use of...
through a use of a suction gun. There's many other methods employed, but the objective is to create an internal pressure on the skin. So the skin is withdrawn in the cup to certain levels depending on the practitioner's discretion.
So the pressure pulls the skin up.
The pressure pulls the skin up.
Yeah.
This has significant physiological activities that takes place.
Yeah, can you explain that a bit more?
So, namely, there's a direct increase of blood supply to the area. So we know wherever blood goes, healing goes, because blood brings oxygen, nutrients, hormones, everything the cells and tissue needs to support the organs, to allow the organ to function efficiently. At the same time, the venous system takes away metabolic waste like carbon dioxide, etc. And we have lymphatic systems which take away bacteria waste. When the cups are applied on the skin and this pressure is created, blood flow is increased, but those systems are also activated. The lymphatic system, the venous system, the capillaries. So cupping essentially draws inflammation, it can draw congestion. It draws harmful substances deep from within the tissue. It affects 4 inches into the tissue. So cupping is the best deep tissue massage known due to the suction of the cup. And by doing this, there's many therapeutic benefits. Cupping treats a wide range of illnesses, very effective for pain-related conditions specifically, like the musculoskeletal problems like arthritis, joint pain, fibromyalgia, muscle injuries, etc. And the way it works, it can be medically and scientifically proven and explained. On our bodies, every surface of skin has what we call nociceptors. These are nerve endings that picks up pain. So pain is picked up in the skin via redness or swelling and injury, the message is sent to the spinal cord, goes to the brain perceives it as pain, depending on the severity. What cupping does is, once a cups are applied to the skin close to the lesion of pain or area of pain, or on it, it triggers what we call mechanothermal receptors. Nerve endings that picks up pressure and heat. When this happens, it bypasses or it blocks the pain because it shares the same roots to the spinal cord, so it blocks the pain. So essentially, cupping is an effective pain blocker without the side effects of gastro problems or nervous problems, etc. This is just one rationale to explain the pain-related conditions, and it's used for various conditions. Like I mentioned, that blood brings healing, and effective circulation or effective blood circulation ensures good nutrition to the organs. So essentially, cupping can benefit just about every type of illness. So from the Sunnah, we find that the Prophet's recommendation for certain illnesses and the recommendation on certain days, we find cupping is branched into two main streams. Curative cupping, which is done for specific conditions on specific body points according to the medical practitioner. And we have Sunnah cupping, which is done for health maintenance.
Well, wonderful. You've explained it in a beautifully elegant and telegraphically summarized it for us to understand the benefits of it. Now, to draw in Professor Bhika and to ask Prof, are there any prophetic traditions on the recommended times of cupping, and what relevance does this have on health? I know, for instance, my sister-in-law does not have her cupping done on a Tuesday because her practitioner does not do it on a Tuesday. Mm-hmm. Yeah.
Okay, I think, Farooq, just to answer the question, first of all, let me just quote the hadith that was narrated by Abu Huraira, in which it is mentioned that the best day for cupping is on the 17th, 19th, and 21st of the lunar month. Mm. Now, what is very significant about this is that from Islamically we are being guided that fasting should be on the 13th, 14th, and 15th. Now, if you take this into account within the context of the medicine, there is a saying from Ibn Sina that cupping at the beginning of the month is not ideal, as the humors are not on the move, nor at the end of the lunar month, as the humors are less plentiful. So the fasting during 13th, 14th, and 15th.
So when you refer to humors, you're meaning
the blood, the body fluids. Okay. Mm. Now the body fluids or the humors are, throughout the lunar cycle, they are made ready between those days, 13th, 14th, and 15th. So the ideal time for Sunnah cupping is on the 17th, 19th, and 21st, because at the time when the body, in its own Pfizer self-healing mechanism, has prepared the body fluid for the elimination. Secondly, just to answer the question that you raised, for Sunnah cupping, this is the ideal time, 17th, 19th, 21st. But again, there is a prophetic tradition, and it is well quoted in books of medicine of the Prophet. But when it comes to illness conditions, cupping can be done at any time. And remember, there are two types of cupping, which we will discuss later: the dry cupping and the wet cupping. So again, the choice of the cupping, depending on the practitioner, is not restricted to any certain day. Yes, when it comes to Sunnah cupping, definitely 17, 19, 21, and certain days. But for medical treatment, it can be on any day within the understanding of the practitioner.
Well, it seems to be solidly based also on the rhythm and the energies of the moon cycle as well. So there is a solid scientific basis then for understanding the body and therefore dealing with cupping and health maintenance. To support you, though, and in the comment that you made also that this tradition is carried across cultures, we have for our viewers a clip by Dr. Pinky Mpashlele, who will talk about cupping in the African medical practices.
Today I'm going to talk about cupping in the African traditional medicine, which has been practiced for centuries before even this medicine, allopathic medicine, is being practiced. We use cupping as healing methods. It is called hopatsa, kasetswana, and it is ukugaba in Zulu. It is used for elimination. It is used also for medication. We use cupping when a person is sick, we use cupping when a person is healthy. Illness conditions that we use cupping for is if a person has got a swelling on an area, then we use a needle, a porcupine needle. We can use a sharp knife, point of a knife. We can also use a blade. They are all sterilized before being used. If a person has got high blood pressure, a porcupine needle can be used to do holes inside the nostrils where blood is going to come out, and thus a person's blood pressure will go down. We relieve pain around an area with a porcupine needle. We pierce little holes, and then the tension goes away and the person will feel better as well. For medication, the holes are made with a razor, and then we put the medicine inside there for whatever problem the problem is. If it is swelling, or if a person is having too much heat in your system, we say that is now if the temperature is too high, we can put in medication in there. We use also for releasing toxins in the system. There are certain medications which are being used, and cupping is also used for spirituality reasons, where medicines which are used for spiritual reasons will be used on a person.
That was Dr. Pinky Mpashlele. The clip supports, in fact, what cupping can do, and what we notice is that it's applied across cultures. Now, in our next clip after the break, or in the next segment after the break, rather, we'll be looking at cupping as a medical science within prophetic medicine. And we'll be focusing on the precautions and also any references to the types of cupping, including dry and wet cupping. Please stay with us. Welcome back. If you've just joined us, we're looking at the concept of cupping. And with me in the studio is Professor Bhika and Dr. Mujib Hussain to discuss the issue around cupping. Just a quick reminder then that in this segment, we'll be looking at cupping as a medical science within prophetic medicine. And we're also going to be looking at making sure that we take the proper precautions, and we make a reference to the different types of cupping, whether it's dry or wet procedures. Let me draw in Professor Bhika and ask, Prof, could you highlight for us, sir, the importance of cupping therapy as a medical science within prophetic medicine?
Certainly, Farouk. And as always, I corroborate my discussion with an extract from Ibn Nabawi. There is a hadith narrated by Amaru ibn Sa'ib, which says, "Whoever gives medical treatment but is not recognized as a physician, and who thereby causes death or anything short of it, will be held responsible for this." Now, while this is a very broad statement in terms of ethics as far as Ibn Nabawi, and in fact ethics within the general sense of medicine, it's very relevant for us to also understand that cupping has to be done by an appropriate person who is adequately qualified to actually do cupping. Sunnah cupping is reasonably safe as long as it is done within the proper clinical, scientific, and the precautionary measures. But even cupping, Sunnah cupping, fine, but when it comes to medical treatment cupping, one has to be very sure about the aspects before people just go into this field.
So you can't just go to any practitioner. You have to be sure that they are well informed as to their craft. Let me ask Dr. Mujib Hussain then, if he could unpack or inform us on the precautions and the safety measures of cupping, mindful, of course, of what Professor Bhika has just said about making sure that the practitioner knows their craft, or as some people would say, has a conscience of the craft and a craft of conscience.
Of course. Yeah, definitely cupping therapy is a medical procedure, and every medical procedure has contraindications, it has adverse effects, etc. So firstly, I would like to highlight the differences between what we call wet and dry cupping. Dry cupping essentially stimulates the body, it stimulates circulation, removes inflammation and congestion. So it acts as a deep tissue massage, it helps cleanse, it activates the immune system, etc.
So it'll be a lot like what you did earlier on.
Yes.
With the, yeah.
Wet cupping is when we actually cause light paper cuts on the skin to allow the body to remove that harmful substances that has been determined or found by the practitioner. But it's done according to diagnostic measures. So the practitioner should definitely be trained in anatomy and physiology, understand disease processes, understand the philosophy of humors on how fluids flow in the body. And it's not merely that cupping is sunnah, so now cupping can be performed on anybody. Because it's from the sunnah, it has to be professional. It has to be respected as a medical science. So before cupping takes place, a thorough patient history is needed. What are the current illnesses? What medication are you on? Not merely just the medication. The practitioner should have a knowledge of allopathic medication. What are the side effects? For instance, blood thinners will increase the risk of bleeding, which is very crucial. Wet cupping cannot be performed on anemics. It cannot be performed on hypertensive people. Blood pressure has to be taken. Heart rate has to be taken. Dry cupping generally is safe. However, it shouldn't be done on children below the age of 3. Dry cupping shouldn't be done on the elderly, or people that are very, with a low constitution, or malnourished people that are very fatigued. In other words, people that have loss of energy, because cupping can be a bit draining. Wet cupping shouldn't be done on people over the age of 65. However, according to the practitioner's discretion, there are some people over that age that has a strong constitution. So wet cupping is ideally to remove excess from the body. So excess cannot be removed from a depleted person. So therefore the knowledge of the science is very important. Other precautions, we wouldn't do cupping on any skin lesions, any eruptions on the skin, any allergic areas, any varicosities, varicose veins, etc. Cupping shouldn't be done on the abdomen and the sacral regions of pregnant women. Cupping shouldn't be done on the breasts of breastfeeding women. So there's many precautions that is taken in, and each precaution suits the illness. So therefore a comprehensive understanding of the body is important for cupping.
So it's useful to go to those practitioners who, if it's an advantage, of course, it will be a bonus to have a medical doctor plus a doctor combined.
A registered practitioner, because when someone is registered, they have authority to answer to. So therefore, the rights of the patients are protected.
Is there a lot of bleeding during wet procedures?
It depends on the individual, because each body has a different effect.
Okay, in understanding this procedure, I was intrigued that you said that people get quite drained with cupping as well. Any closing thoughts then, Dr. Mujib, on this topic?
Okay, definitely it's well documented and proven within the Sunnah that cupping is an indispensable therapy used for mankind as it was recommended. And today cupping has evolved into a medical science that is proven. And it's for us to actually use this as an adjunct to conventional therapy, to better other types of treatment. So by introducing cupping into our therapy, we'll definitely increase the well-being of our patients.
Well, it would be entirely remiss of me if I didn't ask Professor Bhika for any closing thoughts on this important practice of cupping.
Alhamdulillah, all that I can say is that while we're looking for so many different therapeutic options, as Muslims, we should definitely try and see and try and incorporate cupping as one of the options that we should look at.
Thank you very much to both of you, Professor Bhika and Dr. Mujib Hussain. This program looked at the practice of cupping and its implication in terms of health promotion. In this episode, we've looked at cupping as a sunnah and health promotion, and it's an important practice of Tib al-Nabawi, and why cupping should be done in a safe and effective practice in the treatment of illness condition. Now, in our next episode, folks, we'll discuss the physical and spiritual benefits of fasting, as well as dietary adjustments in the treatment according to the prophetic medicine and the practice of Tib al-Nabawi. You've been watching Medicine of the Prophet, your guide to healthy living. And we hope to see you the next time round, inshallah, Ameen. Assalamu alaikum wa rahmatullahi wa barakatuh.